Good morning, good morning, good morning. Thank you so much for joining us this morning. And on behalf of the American Heart Association, thank you to No More Martyrs for having us for the summit and recognizing the need for us to prioritize our mental health, which impacts our overall cardiovascular health. I am Pamela Garmon Johnson. I serve as the National Vice President of Health Equity and Partnerships, as well as the Executive Director for the National Hypertension Control Initiative. Okay, the title alone speaks volumes to you got to have balance, but I do have it, and we're going to talk about that today. I am joined by Dr. Brandi Pritchett-Johnson, a licensed psychologist and the owner of the Diane Group, a therapy and consulting firm that specializes in intergenerational family and racial and cultural trauma. And my story about Dr. Johnson is we actually ended up, she was presenting to a group of young people about their mental health as a part of an organization that I belong to. And she's also been a volunteer for the American Heart Association and uplifted her business through that avenue. And I'm sure she's going to share that as well. I'm also joined by Dr. Anna Sierra, a licensed professional counselor serving the DC metro area. She has worked with adults, children, and adolescents from outpatient, residential, and home and community environments. So welcome, 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 and looking forward to this discussion, ladies.
Good to see you again, cousin. One Johnson to another.
Exactly.
Dr. Anna.
Well, we know that the people in the United States are more stressed than ever. I know that I have been, the pandemic, being at home, distance learning, trying to navigate, your child in high school and, just your overall work-life balance. We are stressed. There is a lot going on in our lives. And if you turn on the TV, you become even more stressed. Therefore, I do not watch it before I go to bed. But we have grappled with so much, the effects and uncertainties that have come from COVID-19, and then just our own personal and professional lives. And now, even with the market, it's like I travel, I see people traveling everywhere. The flights are full. So we may have inflation, but we're still spending our money. So, and maybe it's just because we need a break and individuals are just trying to have a balance. We also know that women, especially women of color, suffer disproportionately from adverse life experiences like discrimination and racism that can lead to anxiety and toxic levels of chronic stress, which is linked to hypertension and heart disease, the #1 killer of women. These are all startling implications. Taking time to address mental health and well-being is more important than ever. Chronic stressors like long work hours, work-life conflicts, and finances may be as harmful to health as secondhand smoke. That's pretty alarming. So as a champion of health equity for all people, the American Heart Association is more determined than ever to leverage our voice, platform, and resources to identify and remove barriers that prevent people from living healthy lives, and are grateful to share expert voices at the Mental Health Equity and Liberation Summit that will offer nuggets to help all of us live our healthiest lives. So with that, I want our panelists to come off mute and we're going to have a conversation.
Let's do it.
All right. Well, let's start with the first question. Studies have shown that 1 in 3 adults in the US report being worried or depressed. How does this constant stress affect our health?
Ooh. Yeah. You wanted to start with a big one, huh?
Yeah.
I did. We got to go out with a home run at the very beginning.
Dr. Anna, I'm sorry I cut you off.
No, I was going to say the same. It's a big one. But I think it does go with what you were just saying, that the chronic stress that women of color experience more, not just from the pandemic recently, but from childhood through now. So it is a longer term issue, and because of the systemic inequities and disparities, our communities tend to be underserved in so many levels. And I think that's just, it goes also back to what the earlier presenter was discussing of the microaggressions. We largely not realize how much that really affects our internal conversations with ourselves, our ability to manage spaces, just the smallest ways of behaving in spaces or trying to figure out spaces, to the bigger ones, which are true disparities across educational health and also access to mental health.
I think the only thing I would add is that I've noticed that the accumulated impact of all the stress. So, stress isn't new to us. To Dr. Anna's point, we kind of have inherited a certain level of stress. I work with a lot of clients and individuals that are bringing with them their inheritance of intergenerational stress or trauma or anxiety. It's kind of passed down. So it doesn't just go away if unaddressed. So with some of the more chronic or even acute stressors that we've all endured over the last 2 years, it's not like it's on a blank canvas, it's accumulated. And I think one of the things I've noticed most in my own personal life, amongst my community of friends and networks, as well as in my clientele, is that as a resilient people, sometimes it's actually harder to detect because we compartmentalize, or we have found strategies, as maladaptive as they may be sometimes, we found strategies to just survive, like to just get it done. So you start to hear language these days around like functioning or high functioning depression, where people aren't, and I hope this doesn't sound condescending, but our prior idea of what depression looks like was crying in a corner. People aren't crying, people are living out loud. They're functioning, they're working hard, they're making money, but inside they're just miserable or worn out. So it's kind of manifested in some real interesting, I think, cultural ways.
Mm-hmm.
I just wanted to add that, this notion that we cannot fail, and we have to show up, especially as women of color, because if we fail, then it's not just about letting ourselves down, but all those that are behind us too. And we carry that burden, and that is stressful. And then it causes us to lose sleep, which lack of sleep is now the 8th risk factor for cardiovascular disease. That just came out last week. But think about that. And I want to talk about that a little bit, because we do carry that burden. Many of us, especially those of us that are the only one, or we're an executive, we're the CEO of our business, we carry a lot of burden. And then if we don't get the clients, we also have the staff that we're paying for. That's their livelihood. So you're carrying a lot of weight. So I would love for the two of you to speak to that.
We launched the Latina Healing Institute back in January of this year, which is a new initiative in the practice that I'm in here in DC. So when we launched this, we had a flood, and tell you that a flood of women reaching out, craving this space to talk about, especially being professional women, women that have had fought through spaces that are not designed for us, women that have gone through the academia process. If we've been there, we know what it is. what it's like. But we've had an immense amount of women just come in and saying, wow, I can't believe this exists for women, for us to talk, for us to say, to feel safe in a space and say, do we get it? What happens in that process? And not having to explain it, not having to think that you are going crazy inside by either being told you are exaggerating, that you are actually not, taking it, you're taking it personal when, people don't see you as a person in spaces like this. And this has really been something that, me and my co-founder for that project, we've known from our experiences as Latina women in spaces that are primarily white dominated, but opening up that space, even women who didn't realize that this was something they were battling internally. Like this has a name. This has actually like a name, a last name, and a way to cope with it. And that resource out there has been such a great space to talk about this. Like, we don't realize we have people that are chronically sick, that are that feel that they're just becoming angry at work or in their environment and academia. But it's not really that. It's just having to navigate these things on a day-to-day basis puts a heavy burden in ourselves. And I speak from experience of that too, having been in spaces where you are the only person that looks like you, and then you have to kind of navigate that space without jeopardizing your identity. And I think that's a hard skill to teach out there. No one teaches you this except other people that go through this.
Yeah, it's like, it feels like it's a hard skill. It's a valuable skill, a hard skill, and a burdensome skill, if I'm gonna be real, because I appreciate what you're saying, Pamela, in recognition of like the additional sense of responsibility as leaders, right? As leaders of color, and recognizing the disparities. So as a private practice owner, I know what we call the 1099 model, the fee split model. And I also know that there's economic disparity. All of my clinicians are people of color. I'm not going to contribute to that. So that means I'm going to pay them more, which means that my bottom line is less, which means that I work more. And so there's all these intricate pieces that are simultaneously like liberating and exciting and that I'm so proud of, but that are also impact my mood or like my sense of energy or my capacity. Dr. Anna, the Latina Healing Institute sounds like such an incredible safe haven, because I know our clientele has actually, it's increased having other therapists of color, dealing with compassion fatigue or just the trauma triggers, because we're all in this together. We're going through some of the same things that our clients are going through. We created a intervention called Invincible Black Women, and it was intended to kind of appeal to like the super strong women amongst us, and then kind of debunk the myth that we're invincible. Like, we're not. Our impact is invincible. And so we need to preserve our spirits. And it sounds like equally valuable to the women that join the group. So we're simultaneously caring for clientele and then caring for each other,
I love that our impact is not invincible. That is really,
girl.
Love that. I love that. One of the things, I had a traumatic experience at the beginning of this year. And I pulled away from everything. And I just, every day I went through meditation. It was about an hour process. And not to lift up a particular product or process, but it was a 21-day meditation process. And what I can tell you, being quiet with your own thoughts and writing was transformational for me. It was the first time I had ever done it. And I didn't talk to my friends. I didn't talk to anyone. I talked to my husband. I didn't really talk to him that much because I needed to center myself, even my child, like, I ate dinner with them and all that, but I needed that space to figure out what was best for me and how was I going to have that balance in order to be the healthiest for me. And I know that we say, I don't have time, and that's the reason why I didn't do it that before, like just being quiet. And sometimes we're scared to be quiet and alone by ourselves. I don't know what that is, but I was one of those people. And but I will tell you, it helped me grow as a person. And we do make time for the things that we will make time for. So I do want you to speak to, how do you create that balance? Because that balance and saying the word no helps you get there. The power of the word no, N-O, the power of it. And saying, I only have the capacity to do these things. But I do want to talk, I would love for you to talk about that balance and how it contributes to overall mental health and well-being and the impact that it has on one's health.
Let me tell you something. It's 11:31 here Eastern Standard Time, and my day has already tried to interrupt my harmony, okay? Already, like the simplest things and some really, really major things have already tried to interrupt my joy and my peace today, okay? So I really resonate with what you're describing and how there's so many things that can just distract us from our core. And there are so many things that can entice us too. Like, they're not all bad things. But just to answer your question most explicitly, what do I do to create balance? I think first and foremost, and I work with clients on this, I really try to find the language that speaks to their spirit. So like for me, I really try to create harmony, like create alignments and harmony. And so I'm discovering so many cool things. I'm actually very curious and would like for you to put in the chat your 21-day meditation for me. But I have stumbled upon the most amazing like hip hop dance class. It's just super ratchet and fun. And like, so I do that 2 or 3 times a week, which means I'm always in a bun and I'm always in a ponytail and I could care less. It does wonders for my energy. And then yoga meditation has just realigned my nervous system. And, people will say that meditation doesn't work, but it's not easy. It's hard. It's like a retraining of your system. And so it's supposed to be hard in the beginning. And there's so many different types. So I think making sure that I use those 2 tools to adjust, and then music, and I have to sing it, I have to listen to it, I have to create it. So music really fits for me too. And then also really making choices, like what you were saying about no. This morning I had to say a very hard no that I'm still not comfortable with, but I know that my no is a yes for something else. And so just really trying to adjust my perspective around what it means to not do something and how I choose how I spend my energy. And the last thing I'll say too that helps me create harmony is this concept of just energy management and not time management, because some things take more energy out of me than other things. There are things that are easeful, and then there are things that are taxing. So it's not just time, it's my energy.
Yeah, I think actually the 21-day meditation that Brandi Pritchett, I've done that one, so I completely know exactly what that means. I did that during COVID. So I try to work with people, and even with myself, like, why do I do this? Why do I want to take care of myself? Is reframe this thinking that we have to take care of ourselves, because if not, we're going to be more stressed. So that's not the right motivation to do so, right? I try to work with reframing that to, you know, I'm gonna get up in the morning and take this 30-minute walk, not to lose weight, not to start some step count, but we're gonna do it just because I'm working on my heart health, you know, on my physical energy for that day, you know, and I'm gonna take that walk just for that. And that's the goal. And that's the new learn motivation that we're gonna do that for. And I'm gonna try to eat healthy, not because I want to lose weight or because I want to get, you know, I want other people to see how healthy I eat, my coworkers or anybody else. But I'm gonna do it maybe one time a day to contribute to a longer term health or a longer term well-being. So reframing why we do what we do, because when we are going to self-care strategies in a space of already stressed, like if I don't take this walk, then this week I'm just going to get more stressed. It will make us stress to do things that de-stress us. So we want to look at what our motivations are to do meditation, to do these things. Yeah, I want to do it because I want to feel a little better, but I also want to do it because I'm adding well-being to my life rather than taking off stress. So looking at like adding good things to yourself, not because we are trying to avoid more stress, but that automatically is going to lessen that later on in the future. And it's about the small things and the day-to-day practices. It's about discipline. And the only way to get disciplined about it is to be in the right space of how we look at it, right? We don't go to the gym and work out because we want to get like super fit and tight. And so maybe that's one goal, but do it because you want to feel good that day, because you want to get your body moving, or because you want to just give yourself that gift that day. So the way that we see these self-care strategies are very important. We have to kind of reflect on that. And talking to other people, it's important. Reaching out to other people. I know as women of color, we don't do that. And the reasons why we don't do that, right? Because we don't want to be seen as weak, or we don't want this complex of I can do everything, I can take care of everything, and that defines my womanhood, even though it doesn't, right? It keeps us in a space of oppression, really, in the middle of in our environment, and you know, against other people around us. You can delegate a lot of things as a woman, and it doesn't mean anything less than from ours. That's just the way we've been brainwired to function, and to feel good and to get self-esteem from that, which then we create other ways to grab self-esteem, right? So reframing a lot of why we do what we do. Why do I do this? And really getting real with your own thoughts and internal motivations for it.
You know, I'm going to pause just really quickly. Does anyone hear this background noise, or is it just me?
I hear it.
Yeah, I just, so it sounds like everyone is hearing it. So let's do this. Let's put ourselves on mute unless we're speaking, and that may clear it up. That worked. Okay, so we will just moving forward, we'll just put ourselves on mute, and then we will, and then once we answer the question, just come off mute. This whole notion of reframing why we do what we do, that is a mental shift for us. Because if you think about it, just having this optimistic approach and mindset, which I feel like comes from the meditation. For me, that's where it comes from, or doing yoga, where you're quiet and still. It allows you to be clear, so that when you're walking into something, you can have a positive thought around it. Or, as you mentioned, like the walking, it's like, oh, I gotta go exercise. I mean, you know, just that, you're like, I don't even want to do it. Like, you don't even get excited. Whereas you're like, oh, I'm gonna go out and enjoy the green trees and look at the flowers. It's just a whole different, the thought process is totally different. And or I get to walk with a friend and we can catch up. It's not like, oh, I got to do that. But, you know, it's more uplifting. So I love this whole reframing why we do what we do. I do want to talk about the whole superwoman complex. having the cape on our back with the big S. Oh my gosh. You know, I'm sure that for those of us that are, you know, we're washing clothes, we got to make sure we get our nails done. We got to get our hair put up because we got to work out. You know, we got to whatever else. We got all these projects, our social organizations, and the list goes on and on and on and on and on. And as the saying goes, busy people get things done, but it also wears on you. And so I do want to talk about the S complex, the superwoman complex. And what do we do about that? And Dr. Sierra, you mentioned a little bit about delegation. And I think about this book I read about 10 years ago. It's called The 4-Day Work Week. I don't know if you all are familiar with it. You all smile. And that's what it's about. What can you take off? What can be delegated, or what can you engage someone to take on some of those responsibilities in order to have a better balance? And so that you don't have to try to do it all. But I would love for each of you to speak to the superwoman complex.
I think that as we are raised in societies where women, especially women of color, are expected to be stronger, and to make that an identity from the time, you know, you're little, it is hard to detach from that. That's part of a huge part of identity, a huge part of, hey, that made me feel good when I was told that I was doing this, I was strong, I was this. So and if we are not reflecting on what actually creates the core of our self-esteem, we could fall into the, I can exhaust myself, but at least I'm getting positive feedback from the world, rather than seeking that positive feedback from yourself and from your internal. So questioning, why do I have to do it all? Or what is it that all, what is that list of all things? And who can help? And how to be okay with getting help. So I ask a lot of women of color, like, how does it feel to be served? And a lot of times they're like, well, I don't know. Like, I don't know. Weird. They say awkward, or like not right. But why is that? Why can't we derive our self-esteem from our inner strength that we already hold without having to prove it to anyone else, or proving it to ourselves? Because that's really where it lies. Like, what are we saying to ourselves when we can't take it all, when we can't do it all, when we feel like maybe this is too much for us, right? So looking at that and being really real with yourself. Does it really, and as women grow into being wives and mothers, it gets bigger. That expectation is huge, because now the children are completely dependent on that, on women. In many households, women have to do double, triple the work. And I'm not saying there are not good men that do good work, but regardless of women marrying a good partner, the woman always ends up doing 2 to 3 times more of the work. And we have to look at what our part is too. How are we delegating? You know, we need to delegate. And we see a shift in the younger generation on how they see the world in this manner. They are not putting up with that anymore. And I'm so proud of that younger generation for being more strong with that, with boundaries. And I would say strong because they realize, they're looking at us, older generations, and they're like, that does not look like I want to be in a space of stress. So I'm gonna like not put up with this from the get-go in a relationship or as myself. I don't have to prove yourself to anyone. I think checking ourselves and what makes us feel good, and if a lot of those things that makes us feel good about ourselves have to do with meeting other people's expectations on our gender role, then we need to reflect on that.
Yeah, I really appreciate it. Even feels like it connects to what you were saying earlier. Like, as you're talking, I'm just taking inventory of my life And I have an incredible partner, an amazing husband who has evolved over the years. But I remember a season where, and I'm sure people can relate to this, where my kids would literally pass him to ask me for something. Like, you got a whole parent right there. Or I remember that, again, that intergenerational inheritance around what it means to be a mother, what it means to be a Black mother, a strong mother, and a good wife, right? I remember some of my elders saying when I would go somewhere, well, where are the kids? I'm like, with their other parent. Oh, that's good that he's babysitting or he's watching the kids, or, like, what do you mean babysitting? So I think the narrative, kind of what you were saying earlier, Dr. Sierra, around like the paradigm shift of how we think about ourselves and the world around us. And I'm raising 2 young Black boys who I want to be self-sufficient. So my challenge is not doing everything for them because I love them and they're so cute. And so that's my challenge, is saying no, not just in service of me, but also them. So it's like mutually beneficial for me to take care of me. And sometimes, I hate to admit this, but sometimes that's what I rely on. Like, what is the intention of this behavior or what I'm doing? Because it can become very cumbersome. So I think you're right. I think the narrative is changing. I think that the roles are changing. I think we're such multidimensional people, so it's changing. But to Pamela's point, I know I have felt at times like indebted. So, because the question was that your question, Dr. Sierra, about what does it feel like to be served? It has been such an unfamiliar feeling that it would feel indebted, like I owe something. And so it's been an awakening, like moving beyond that kind of bondage,
This may seem really small, but one of the things that, I travel a lot, right? So sometimes when someone offers to either put your suitcase up or take it down, I used to say, oh no, I got it. Now when they offer it, I was like, oh, thank you so much. Because I'm like, to your point, Dr. Sierra, this whole notion of being served, we don't really know what that looks like. And we're like, oh no, I got it. But really, you're like, that suitcase is heavy, and I really don't want to have to put it up there or take it down. But it's the little things that actually, when people offer it, just say thank you. Or I've also noticed this as women, when someone may say, oh, you look so nice today, or that is a nice outfit that you have on. And we always come back and say, oh, this old thing, oh, I had this 10 years ago, or, whatever, instead of just saying, thank you. Accept the compliment, and it feeds your soul. Just these little things help us with our overall, I believe, our overall mental well-being. And it's affirming, right? Because you put effort into getting ready for the day and, preparing to do whatever you are going to do. But those affirmations mean a lot. And so I want to talk about that a little bit more based upon your respective work, and you have respective practices. And I love this Latino Healing Institute. I love that. And I want to talk about how to lean in and taking the step towards seeking help. How do you do that? How do you encourage yourself to do that? Or if you have a friend or a family member, what are the steps that you can take to help them to seek help?
I can quickly just give you some pointers, even from like my own experiences of having to run into that, having to have my family like go and seek some help too. Me seeking my own therapy back in my 20s. because realizing that this is something that's important for general well-being. But I think that we live in communities where we really care about each other a lot. We are interconnected, not interdependent, right? Interconnected with each other. We care about each other so much. And then in the Latinx community, and also we really changed the way they see help. Like, so how do you see help is important. Do you see it as a sign of weakness, or do you see it as a way to bring your community together, right? And they're like, what is that? Yes, you know, if you take care of you, I'm going to be well if you take care of you. So that interconnectedness that we have with each other, having vulnerable conversations with the people we love, right? Even with ourselves, like, it's not, the more that the better that I am mental health wise, you know, emotionally and physically and just healthy, the better my community will be. So looking at us as that, you know, valuing that connection that we have with each other. I can, you know, not go to therapy, not do anything, and just keep on bearing it and enduring and all of that stuff. But that's going to be noticed around, because, you know, we can tell when somebody else needs rest, needs to like take a step back. And we don't want to see you hurt. We don't want to see you hurt, because as women, just with all the pressure we have on our shoulders to represent our communities and spaces that we are the only people there to represent ourselves, we have to be the ones to take care of ourselves the most, right? Because we give that true and honest representation of who we are, but also learn those boundaries of, you know, I don't know everything about my people. And having those conversations and being more self-aware of things. I remember working in a very predominantly white American space, and it was really hard to just be there every day, because there was not one day I think a lot of women of color would, you know, relate to this. There was not one day that I didn't get something, some microaggression, some micro-invalidation, or outright racism, right? Or you're just a diversity hire, or you're just, you know, I can't understand what you're saying because your accent is so thick. I'm like, really? Okay, but we are speaking those, you know. So the better that we are, the more we can handle those spaces, the more we can represent our communities in that space, because it's not just about us, right? We are interconnected. We are, and know that as women of color, we can lean into each other, right, to seek out that support as well. But definitely looking at doing this for ourselves, so that we can be that person that is, you know, at their best potential, doing the hard work we have to do every day. So encouraging, you know, you to be okay with being vulnerable in that space, and having the support around you of other women to, and this is the reason why we started the Latina Healing Institute. You know, there was no network like specifically that way. So we wanted to create that space to bring women that get it. And it was really magical to sit in a room, well, in a Zoom room, and everyone gets it, gets why we're here. That is just a completely different experience. It's a healing experience from being spaces where I have to constantly prove or tell people that I'm not, you know, the entire Latin America or the entire world of like, or know everything about it. So it is interesting to look at those different experiences. We have to look at those spaces and seek out those spaces that we are seeing women like that look like us to discuss and to connect with each other as well.
You said there were so many nuggets in there, Dr. Sierra, that I think one of the ones that really stick out to me is like, how do you see help? And to Pamela's question around like, how do you lean into this journey of like healing and self-care? And, you know, it's really, the prerequisite is even just noticing, like just noticing when you're not operating within your like greatest dimension of yourself. And I don't mean perfection, but I just mean alignment, and not to judge it, but just to notice, because it helps you pivot. It helps you, you know, make different choices. And I think that what you were saying about being interconnected too, I'm learning, and I've learned, and I've been a great beneficiary of women that I love and that I respect and admire their vulnerability. Like how acknowledging I'm sad or I'm in pain or this really hurt me, how that has supported me. That hasn't necessarily burdened me or made me look at them differently. If anything, I admire it. And so I think that whole, like, how do you see help in service of yourself and your community is a big paradigm shift. Like, vulnerability is the greatest superpower of all, because it teaches people how to treat you. It reduces the likelihood of accumulating resentment that you have to then work through later. So I think it's a great tool. And, you know, we always, in relationships and such, we're always talking about how you need good communication. We're talking about vulnerable, introspective communication. That's a very sophisticated type of communication. And so the more we can practice that and nurture that and see that as a superpower, I think that that's a way to contribute to the community as a whole. And the narrative's changing. I'm thinking of our Invincible Black Women's Group. And I mean, we have women that are 14, young women in our adolescent version of it. And we have women that have never done therapy that are 82 years old. You know, so we're taking control of our humanity. And I'm so proud of that. So I think that is encouraging too. You know, I could go on and on, but I think that's my 2 cents.
Oh, I love both of your feedback, you know, because it is so important for us to help ourselves. You know, that's the whole put the oxygen mask on first, you, and then you help others. And so that being still and working on yourself is so important to this mental health journey, mental wellness journey, in order to then help others go on a journey too. You know, I know we're getting close to time, and I wanted to end with a story, and then I want each of you to provide your closing remarks. You know, I remember when my son was very young and I was traveling a lot, and, you know, I was getting up, taking early flights, and, you know, and I was breaking down. Like, I was depressed. I didn't realize I was depressed. And I didn't realize that how my behavior and how I was communicating with others, it was because I was depressed. And you know, that there's a lot that comes with that too, right? You know, it impacts your work environment, and people think that you're a certain way, but they didn't know really what was going on with me. You know, I had my best friend that had cancer, you know, I dealing with aging parents, all of that, like really coming together and like eating away at you. And I just had to say, oh my gosh, I need assistance. And I had the most amazing physician who talked to me for 90 minutes. Now, she was behind with her other patients, but she talked to me, and she helped me get a therapist. And she's like, and Pamela, I want you once a month to have a day to yourself. Even if you go, and I want you to leave the phone, everything, let it be, because only you can take control of your life. So I'm going to help you on that journey. And she did. And it truly was life-changing for me. And every time I start to get out of balance, I go back to, okay, I'm starting to fall into that again. Need to recenter, get the assistance that I need in order to be my best self. So with that, that is my story. And that is my vulnerability. And I do speak about this a lot more than I ever have. But I recognize that it allows other people to be vulnerable and they can see themselves. Because before we just hold it in and we just suffer in silence. And so I would love for each of you just to provide closing remarks to help others not suffer in silence so that they can have the best mental health for themselves so that they can be the best for themselves and their communities.
Well, go ahead, Brandi.
It's okay. Thank you for sharing that, Pamela, because it made me want to think of something. I don't want to overgeneralize here, but I do know that because of the resilience factor, a lot of our depression and a lot of our anxiety shows up as irritability. And so people don't know necessarily how to receive that. And I really want to change the narrative around that, she might not have a bad attitude. She might just be hurting. And that's how it's coming out, and not necessarily to excuse it, but to inquire and be curious and compassionate towards it and have empathy. A really close person to me told me she didn't know she was depressed until she wasn't. When she went to order some French fries, they were cold and she ate them anyway and said, they're busy today. I'm not gonna make a big deal of it. And she realized that had that happened 2 years before, she would have went off. She said, I would have ripped them a new one over these cold fries because it would have felt like just another thing going wrong. And so just noticing our irritability and noticing our just sense of urgency, that again, that's a power tool. And so I appreciate you sharing your story. I think that I lost track of the question. What was the question?
Just your closing remarks.
Closing remarks. See, my mind is going a mile a minute because there's just so much it's so intricate. It's so interconnected. And I think that it actually, even for myself in this moment, it kind of just boils down to the simplicity of the breath or just pausing or just being quiet so that you could catch up. Right? I mean, I think it's even kind of manifesting for me in this moment. So I appreciate your vulnerability, and I'm offering all of you mine, that we're kind of in this thing together. We are very much interconnected, and taking an opportunity to talk about, health and wellness of women of color in particular deserves a platform. And so I just want to thank you all for doing that.
Yeah, vulnerability does open up other people to be vulnerable, and that's the reaction that it's very magical for that to happen. But also just going back to, I see a comment on from Sanja that she says that could be categorized as unprofessional. I would say that you are right. Remember that in spaces that are professional in academia, we are expected to be, everybody's looking out for us to fail. So any weakness or anything bad or anything different is going to be magnified, and that is stressful on its own. But just knowing that a lot of us are in that same space, we are suffering in that space together. And sometimes we just don't talk about it because in that space, right? Because it's not safe. So I would say find spaces that are safe to do so, because for me, I could never be vulnerable in a space where people didn't look like me, because I'm thinking, wow, this is just gonna look like another woman of color is either just not functioning well or something like that, or not performing, or will not perform well because she's struggling. But in reality, finding spaces where I can say that to other women that that I feel safe with. This is really hard. Like navigating spaces is really hard. I go home and I question whether I'm am I smart enough to write a report like that? But then I wrote reports like that my entire career. So that is what really matters, to say it in spaces that are vulnerable, that will not take our vulnerability, but as, you know, as a sign, as a weakness, or as a way to point out something wrong, because not every space that we share it is going to be taken the right, you know, the right way. So definitely seek out other people that can understand what you're talking about, what we're talking about. We've had a lot of women in our groups that just kind of break down crying, just saying, it's so just the fact that you guys believe me is like healing for me. And I never thought I could find a space where I could just say these things and not feel like crazy, that I'm just making it up, or or doing things like that. And I share my own too. I've, you know, the most stressful time of my life has been in very much white dominated spaces, because you tend to go back to all of those questioning yourself and figuring out every mistake you make is magnified. Every time you speak in a way that is not okay, this magnified as well. But when you do well, no one notices. So it is stressful to be in some spaces. So I would say really pick and choose where you share private things about yourself.
Well, let me just say, on behalf of the American Heart Association, I just want to thank Dr. Brandi Pritchett-Johnson and Dr. Anna Sierra for your contribution today, your expertise. I know that you are trained in this area to really help others on their mental wellness journey, and just really grateful for your contribution. And also to Dr. Nadia Richardson. You are just an amazing person. I am glad that I've had the opportunity to meet you in the past, work with you and collaborate with you and run with you. And I'm just so excited that you are also realizing your dream to help women, and specifically women of color, seek help and also provide the assistance that they need to be their best selves. And so thank you, thank you, thank you. And thank you to the audience for your questions and for giving us your time today. So with that, I will close out and turn it back over to Dr. Richardson.